Did you know that nonprofit hospitals, those with 501(c)(3) tax-exempt status, are legally required to offer financial assistance and limit what they charge you? The vast majority of hospitals are tax-exempt. Unfortunately, it doesn't mean they are charitable. Far from it. They sue more people than any other industry and don't share key information with you that can protect you. Let's break down what the law says and what hospitals are supposed to do to keep their nonprofit benefits. Under IRS Code Section 501(r), nonprofit hospitals must meet 4 key obligations to maintain their tax-exempt status. 1. Have and share a financial assistance policy, or FAP. 2. Limit charges for emergency and medically necessary care to eligible patients. 3. Avoid aggressive collections until they've checked if you qualify for help. 4. Conduct a community health needs assessment every 3 years. What's a financial assistance policy? The financial assistance policy must explain who qualifies for free or discounted care, how to apply, how they calculate the charges, and how the hospital shares this information with the public. Hospitals must post their policy online, provide it in public spaces, and offer it in multiple languages where needed. And it must include a plain language summary so people can actually understand it. We want you to know that qualifying may be easier than you may expect. Here's where it gets important. If you qualify for financial help, the hospital can't charge you more than what they usually get paid by insurance. That amount is called AGB, or amounts generally billed. It's the average amount hospitals actually collect from Medicare and private insurers, not their full inflated sticker prices. How do they calculate AGB? Hospitals can use one of 2 IRS-approved methods, the look-back method, based on what insurers and Medicare actually paid over the past year. The prospective Medicare method, based on what Medicare would pay today, including patient copays. They must pick one, describe it in their FAP, and apply it consistently. If hospitals don't follow these rules, they risk losing their nonprofit status, facing IRS penalties, and harming their public trust. But most importantly, patients like you may miss out on help you're legally entitled to. Uninsured patients and underinsured patients qualify if they are under certain financial thresholds, earnings below an amount, often a multiple of the poverty line. A multiple in average community we looked at was $96,000 or less a year in earnings. This varies by community, but it is much higher than people often think. Net worth less than $250,000. Also, this excludes your home and retirement. A significant number of people qualify that don't know it. What does being underinsured mean? Wow, that means everyone should check to see if they qualify. In one example from a Midwestern community hospital, patients with incomes up to 300% of the federal poverty guidelines may qualify for partial or full discounts on emergency or medically necessary care. Applicants under 200% of the poverty line at certain federally affiliated clinics don't even need to submit asset information. All charges for eligible patients are capped at the amounts generally billed, AGB, what insurance and Medicare typically pay. Applications are available in person, by mail, phone, or online, with support in English, Spanish, and Hmong. Financial counselors help guide the process. And if you might be eligible for Medicaid, the hospital encourages you to apply to support qualification. Bottom line, you could be eligible and not know it. If you're uninsured or struggling with hospital bills, ask for the financial assistance policy or check the hospital's website. You might not owe as much as you think. Because nonprofit hospitals get massive tax breaks, they are required to help their communities. So let's hold them to it.